My name is Dr. Barbara Rodwin, and we're going to talk about making use of a heel lift within your shoe to be able to help realign your body. Now, with respect to using these, I do find over the years in my clinical experience that if we add a heel lift in for patients that have uneven feet, knees, hips, and lower back, and even sometimes a mild curve in their spine, it does help to improve their condition quicker while I'm treating it. Because what we're doing is evening things out, and then the body actually thinks in between treatments that it's even, and it helps relax the muscles, the joints, the ligaments that attach the bones to the bones, and the tendons a lot quicker. And I find it helps them improve quite a bit better, faster. So with respect to the heel lifts, there's actually 4 different heights. I have them in my hand, and you can probably be able to see that as you go down, they get thicker. On the lifts, there's actually a letter and a number. The letter corresponds to the height of the lift. The number corresponds to the width. Because the A1 compared to a D4, you can see that it's actually thicker, but it's also wider, the D4. So each lift has 4 different widths. So the A, which is 1/8 of an inch, has an A1, 2, 3, 4. And what I find with these lifts is we actually take, and I'll actually check with the patient. So if a patient is uneven and their hips are off like this much, we'll actually figure out which lift to put underneath them to be able to help even them out. And patients can't believe the difference with this because it makes their hips feel looser, their knees, their feet, and even their back to be able to help with their treatment. So with respect to the heel lift, when we ask that a patient wear it, we ask that they wear it at all times, even inside their house. So if they're actually walking around in bare feet or sock feet, we'll ask that they wear a pair of sandals or shoes in the house and wear it every place that they go, even at work, exercise. Some people think that when they're biking they don't require it, but they do, because then it keeps their hips even while they're cycling. And if you wear it at all times, they do improve actually a lot faster. Another patient question that I often get from patients is, do I have to wear it forever? Not necessarily. What we do find during the treatment process, as we're doing actually the active release and chiropractic on different parts of their body, we do find that they do improve, and often the height of the lift that they're wearing can be reduced. So let's say they start with the D height, which is the highest one. We do find over time that they might reduce to the C and then the B. Some patients, because they do have hereditary curves in their spine, or they've had accidents that have caused that curve, and they are older and their spine is already developed, do need to wear a lift later in order to keep their body even. And the nice thing about that is keeping it even will keep pressure off of especially the hips, the knees, and the lower back, which will slow down the arthritic changes that could occur there and make them feel a lot better. They do over time wear out. They are made of cork, and what you should look at when you do get one is if they start to actually press in over time. So we do ask that patients pull them out periodically and have a look at them. And it is dependent on use and how much you use one. So if you're using one heel lift and moving it through all your different shoes, it's going to wear out quicker than if you're actually getting a couple heel lifts and putting one in each of your shoes and footwear. Another question that we often get from patients as well is, how much do they cost? They're not orthotics. They're a simple little heel lift that gets inserted into one of your shoes to even your body out. And they are less than $10 with respect to them. They're presently a little over $5 to actually purchase one. And so you could even buy a couple of them in order to be able to use them. Often patients will come in and they won't actually have their heel lift in one pair of their footwear, even though that we ask them to wear it always. I am now going to explain how to get it into different footwear. With respect to the heel lift, if you are putting it into footwear where the insole pulls up, so if you do have orthotics and the insole pulls up, just place it underneath and push it to the back. The wide part goes to the back. The cork facing down, and then you put your insole back in. And that way when you put your foot in your shoe, it doesn't slip forward. Now with respect to heel lifts in other shoes, so women with dress shoes or sandals that open at the back, the sandal opens at the back, what we'd be looking at doing is using clear packing tape. You cut 2 pieces, which I've already done, and you take the 2 pieces and you roll them up. You place them on the bottom so that they cover just the bottom. Now I have had a patient use duct tape once. I don't recommend that because it does ruin the bottom of your shoe trying to take the heel lift out. So I do recommend the clear packing tape. I have had patients ask me, should I use Velcro? The only issue with the Velcro when you use it, it does add height. With the clear packing tape, it doesn't add height because you can see I've covered the whole bottom. And then what you do is you push it into the back end of your shoe and you hold that and it'll keep it down for you. So it'll stay down. So this can go into women's pumps and anything and it won't come out. And the nice thing with that is then you can pull it out and put it into another shoe. I have found with the use of these heel lifts, because I have been using them more and more over the last number of years, that patients' pain goes down quicker, their flexibility improves far faster with the use of it because it's allowing their body to stay even outside of the treatment, and it keeps pressure off of, as I mentioned before, the muscles and joints and everything else in their body. With respect to the use of these heel lifts, I have found over the last number of years I've been using them more and more with different patients for their care in the clinic. And I find that with the use of these, as a result of their body being uneven, placing the heel lift in evens them out. So if they're uneven like this, it evens them out. And it actually helps reduce their pain a lot quicker. Their flexibility improves a lot faster. And they find that than I do, and they do find as well that they respond so much faster than not using them like I used to in the past. So if you do have any questions about the use of your heel lift, or if you feel you do need a heel lift, feel free to email me. This is Paulette.
Good morning.
What we're going to do right now is demonstrate to you how I would actually fit for a heel lift. So I think you remember from the video earlier on, there were 4 different heights in A, B, C, and D, and they get higher as the letters go up. So the A is an 1/8, and then we go up to a 1/2 inch with the D. So with respect to Paulette, I'm going to place my hands on her hips, and you'll probably notice when I do that, so I have my hands and then I bring my thumbs around to the front, and you can see how her right hip is lower. So what I'm going to demonstrate is determining what height of a lift it would be that we would use. So I'm actually going to put in the correct one initially. So let's put this underneath and drop your foot down. And you'll actually see now that she's even. So when I pull it out, I don't know if you'll be able to see that, how her body shifted to the right with that. So describe what you felt with that, Paulette.
I felt less pull on my left knee with having the lift in, and I felt more stable as far as less unstable on my feet.
Yeah. So you felt like there was more pressure.
More pressure.
Yeah.
More level.
More level. Okay, so what I'm going to demonstrate right now is we actually had to use a C lift, which is 1/4 inch for Paulette. I'm actually just going to put in the A, which is 1/8 inch, and show you that it actually wouldn't even her out. And with that one, you probably feel like it brought you up a little bit, but not by much,
Yeah,
did
I didn't
it?
feel much.
No, and you can see how she's still uneven with that. So it does take, you just have to sort of look to see which one it is. I'm going to put the C back in again. And you can see she's even. When I pull it out, her body shifted off again. Feels different, doesn't it?
Yeah.
And that's how we would fit for a heel lift. bye.